So good morning, everybody. My name is Katie Walsh, and I'm the Interim Development Director at Compass Mark. Eric, Bevan, and I would like to welcome you to today's webinar. I'll be handing off the presentation to Eric shortly, but I want to go over a few housekeeping rules with everybody. I wanted to let everybody know that today's webinar will be recorded. You have all been placed on mute and without video. If you find yourself unmuted or with a live video, please turn off your microphone and video. I also want to let you know that the chat feature is limited to hosts. So please direct all of your questions directly to me. We'll be answering as many questions as we can towards the end of the presentation. The next piece, and I can't stress this enough, is to please be patient with us. We did not anticipate so many participants, and while we are so excited to have all of you here, like many of you, we've had to pivot our activities and we're still learning the ropes of Zoom. So if you hear kids talking, dogs barking, please know that we are doing our best and we hope that you enjoy the presentation. Again, we want to thank you for being with us today, and we truly couldn't do this without each one of your supports and just being here today. So at this point, I'll pass the presentation to Eric Kennel, our Executive Director, and I just want to thank you, welcome you, and enjoy the presentation.
Thank you, Katie. Good morning, everyone. My name is Eric Kennel, and I'm the Executive Director here at Compass Mark. Like Katie said, we're just really thrilled to see so many people participating today. Some of you are from our primary service areas of Lancaster, Lebanon, and Chester counties, and many of you are also joining us from other parts of the state, so welcome. Addiction prevention is obviously a topic that those of us at Compass Mark are really passionate about. And our hope is that at the end of this presentation, you'll have some new insights into the work that's being done in prevention, as well as some ideas for how you might connect with these efforts personally or professionally, or maybe both. The first thing I want to say here is that our community is currently in the midst of an unprecedented pandemic with COVID-19, and it's impacting nearly every aspect of our daily lives. Our mental, physical health, employment, social life, education, so much more. And while we're dealing with all of these challenges, a secondary crisis is also present in many of our homes, workplaces, and communities, and that's the disease of addiction. Just a couple days ago, I heard the Secretary of the Pennsylvania Department of Drug and Alcohol Programs, Jennifer Smith, commenting that we are navigating a pandemic while we're battling an epidemic. And I think that's really so true. Many of you are professionals on the front lines of this, and many are being personally impacted by both COVID and the disease of addiction. Many of you know that overdose is now the leading cause of accidental death for people under 50, and 1 in 4 families is directly impacted by addiction. There's a lot of sobering news out there, but today we'd really like to focus and orient our discussion around the power of prevention, specifically as it relates to substance use and problem gambling, and the work that's happening in our community to address addiction before it starts. We'll be looking at how prevention is currently being done, review some local data around addiction, and then conclude with some comments about the implications of COVID-19 on the work that we do. Some of you may be familiar with Compass Mark. We're a nonprofit organization based here in Lancaster. Our mission is to prevent addiction through education, skill building, and community mobilization. We were founded in 1966 as the Lancaster chapter of the National Council on Alcoholism. And at that time, as you can imagine, alcoholism and other addictions were just beginning to be recognized as diseases of the brain. And so the organization was really quite groundbreaking in our work to educate the community from that lens. And also we did a lot of direct services to individuals and family members. And as time went on, services expanded to include a wide range of intervention and treatment services. But it's really been in more recent decades that we've really solidified our focus in the area of prevention. We adopted the name Compass Mark in 2008, and the name has significance in terms of our work to guide and empower people on a path towards health and resilience. And it also really alludes to our laser focus, the point on our compass, so to speak, being science-based strategies that are proven to be effective. So we'll be talking a little bit more about what that looks like in a bit. Just to give you, before we do that, I'd like to give you a brief overview of some of the services that we offer here at Compass Mark, for those that may be not familiar with our work and the services we offer. For those that are well-versed in prevention, you know that there are 5 primary federal strategies, which are information dissemination, education, alternatives, problem identification and referral, community-based processes, and environmental. And our programs really incorporate each of these strategies in some way. The Addiction Resource Center is our primary referral and information dissemination program. This program provides one-on-one assistance to help individuals navigate treatment options. And it's also where we do quite a bit of our work in terms of providing education in the community. And our publication clearinghouse is one way that we do that. We also participate in health fairs and do a lot of efforts just to get resources out. So it's important to note in this current situation that we're in that treatment services are open. Many support groups have transitioned to virtual settings. And so it's important that you provide this information to those that you're serving or people that may be in need of help, because help is available. The next bucket of programs is really our school-based services. One of the things that research indicates in prevention is that the earlier we provide services, the greater their effectiveness. Another important aspect that we work at is that we know that the longer we can delay first use, because of those early years of brain development, how critical they are, the more successful prevention will be. So the programs you see listed here are some of the ones that we offer in building up social and emotional learning skills, leadership development services, programs for kids. And these are offered throughout Lancaster and Lebanon counties to students in grades K through 12. The next bucket of programming is our community-based services. And these are really oriented towards higher risk populations. One of them is Skills for Life, which is a program for youth that are 13 to 25 years old and who may already be experimenting with drugs or alcohol. A second program that we started more recently is the Family Services Advocate, and that provides direct assistance to children whose parents are incarcerated. And in addition to some of those higher risk services, we also provide a variety of training programs for employers, teachers, educators on addiction-related topics. One example is the Student Assistance Program, which is a referral and support program that operates in every school district. And we really anticipate that as schools reopen in the coming year, SAP teams are going to be playing a really critical role, more than ever before, really, in connecting students with mental health supports and other community services. Finally, a growing component of our work is community mobilization and technical assistance. You see a map there of Lancaster County. This program provides support to coalition groups around the county. Some of them are United Way collective impact partners, but the work here is really to provide best practices on prevention, help to identify and respond to local, very local issues in the community. We also do this on a limited scale in Lebanon County through our participation in different task forces and community efforts. And it's really about leveraging the impact and getting all of our communities embracing these prevention principles that you're going to be hearing about shortly. So all that being said, those are some of the services that we offer. I encourage you to reach out if you'd like any more information about them. But at this point, I'm going to turn it over to Bevan Allen, and she is our Director of Operations at Compass Mark. She's going to be sharing a little bit more about the technical side of what prevention looks like and why it's so important, especially in this current environment that we're in right now. So Bevan, I'm going to turn over the screen to you at this point.
All righty, thanks, Eric. Well, good morning, everybody. I'm going to do a quick switch over to my screen here. There we go. righty. Well, good morning. I'd like to start by noting that prevention is really both an activity, something that we actively do, and also a field of practice within public health. So this is why I'm sharing with you two definitions this morning. We have first SAMHSA's definition of prevention, which really highlights the actual activity of prevention services. In this primary form, prevention helps people develop knowledge, skills, and attitudes that they need to make good choices or to change harmful behaviors. When we look at the National Prevention Science Coalition's official description, we can see that now we're looking at the bigger picture of those activities across sectors of public health. We see some common language here across those sectors, like evidence-based strategies and societal, community, and individual determinants. Work done in areas like suicide prevention or violence prevention can look very similar and deploy many of the same strategies because of really being underneath that public health or prevention science umbrella. So the field of public health has provided many years of research into the prevention of diseases such as those listed here. Much of the work was done after determining what risks were present at the onset of any disease. It also means looking at what prevented or protected those that didn't experience disease onset but could have. Harvard Medical School research is actually reporting that half of an individual's risk for addiction is predetermined by their genetics. What happens or doesn't happen in the environment influence the genetic risk one way or another. In the case of addiction and use disorders, common environmental factors that can further increase the risk level are stress and, of course, access to substances. Research is also showing us that around 70% of adolescents receiving treatment for substance abuse report experiencing trauma as children. Let's take a minute here to start out, let's see, with that one root cause, risk for addiction, the fact that half of anyone's risk is inherited. That knowledge means that we can start right away with some primary upstream prevention efforts. So we're going to show a quick video here. I'm going to cross my fingers. Everything goes to plan. Oh. All right. All right, well, that was way quicker than I remember it being. So what happened there really quickly was that there were some folks sitting alongside the river, and they suddenly noticed that someone was coming downstream, struggling in the water. And so they threw them a life preserver and pulled them out. And just as soon as they did this, they saw another person coming down the stream, and they pulled them out too. And this continues throughout the day while these fisher folks are getting really exhausted from pulling people out of the water. So finally they said, you know, we have got to figure out why all these folks are in the water. And they went upstream and noticed that individuals were peering over the cliff and falling in. And so that upstream prevention looked like creating a barrier on the cliff so that we weren't losing a bunch of people in the water at one time. And when I was thinking about this in advance of our presentation today, I thought specifically about how we really rallied at the beginning of this COVID-19 issue and headed upstream. We knew that our clients and students were losing our real-time in-person services and really needed supports like AA and small groups and assessments, counseling. So I just want to take a quick second to say, for those of you who really worked on that transition to move those services quickly into a virtual setting, thank you so much. Truly, it has been a job well done. Those upstream efforts, I really believe, have kept folks from falling in and will hopefully help us in our prevention efforts around the situation, so that we don't have too many people in the water at one time when we continue forward and hit some sort of new normal. So why prevention? You know, I really feel like COVID-19 is a defining moment for prevention. We can see really clearly as a world community how differences between the reaction to COVID-19 threat and the proactive approaches mattered, whichever way we went. We know that the work in prevention is going to yield the highest return on our invested funds and time and efforts. Prevention has really never been as important in our lifetime as I believe it is now in this shared trauma experience. So whether you're an employer or a healthcare administrator, a teacher or social service professional, or an elected professional, maybe just someone who really cares about your community, there is addiction prevention impact that you can make where you are that's worth making. Right now, mitigating risks for addiction looks like helping people understand and manage their emotions, developing empathy for others, maintaining or establishing positive relationships, making responsible decisions, and so many other things. Prevention has really come a long way. We'll do a quick timeline overview of sort of how we arrived to where we are today. We've learned so much. A lot of the guesswork in what we do has been taken out. Back in the early days of prevention, we thought we could just provide people with straight information. Then we started to develop formal programming to reach more folks, like the DARE program, which was really focused on educating youth about risk and specific substances. The best data that came out of DARE was really the attachment and bonding opportunity that was created for students and their local law enforcement in their community. We didn't know then what we know now, and much of the work happened with varying degrees of scare tactics scattered throughout that really impacted and increased the stigmatization of addiction. I'm sure many of us remember the egg in the frying pan, this is your brain on drugs. It's important that we recognize and reflect that this is an evolution over time and that we remain open to more change, because as our science evolved, we'll be called to change as well. Yes, this means that in order to continue that forward progression, we have to sometimes give things up that we're kind of attached to, that things that kind of give us feedback, which we really like as adults, things like the satisfaction of kiddos' reaction. Using visual aids like the tar jar, I'm sure a lot of us remember those, or having a classic mock DUI crash can really create this emotional response that we think means, you know, aha, we got through to them. But we really shouldn't be measuring our success in prevention of addiction with those reactions. Science tells us that when we feel fear, we need concrete, practical skills to help resolve that fear and teach us how to be safe. Otherwise, we could really do harm. For example, we wouldn't simply warn people about fires and show them scary pictures of fires and tell them about how harmful it is. We're actually teaching people where the location of the fire exits are, how to use the fire extinguisher, and we practice leaving the building when the fire alarm goes off. It's all about preparing these folks with concrete skills to use in their own moment of choice when they're faced with a decision to use a drug or gamble or engage in another risky behavior. At Compass Mark, we like to say, we're gonna prepare them and not scare them. So hopefully, those of you that don't know a lot about prevention have been sold on the science and the activity. So how are we doing it? You may have picked up by now that there's a basic theme of prevention, increasing protection and reducing risk. We know that some risk factors like genetics are beyond our control. So we really need to work on increasing protective factors and lowering risk factors when possible. We like to regularly use an analogy of a balancing scale. So think about adding pennies to a balance scale over time. Each penny is fairly light and may not move the scale very much, but every one matters and are needed to finally tip the balance in the right direction. A person starts life with risk factors and can really avoid addiction if we're adding enough protection or pennies to the scale. There are even some things that if we can achieve them are worth more than a penny weight in the scale, like delaying the onset of their first use of a substance. For a developing youth's brain, waiting a few years to try alcohol, for example, can dramatically reduce their risk of developing a substance use disorder across the lifespan. The balance scale metaphor can provide a really good context for when you feel like you're not helping enough. Really, any positive change that you encourage in another person's life can contribute toward balancing the scale toward health. So when we're talking about these risk and protective factors, it's important to remember that they sort of all fall into the four primary domains, which encompass an individual's environment, as well as their personal characteristics. These are unique to each of us, but our basic human needs to be safe and fed and belong are consistent needs throughout these domains. Framing our COVID-19 prevention projections, sort of like what we think could happen, how we think people are going to be impacted long-term, and then planning in that context will really help us coordinate and collaborate efforts for the highest return on our work. It's tough right now because we've never been in a similar situation. So we have to really work together to use what data we have and attempt to make some truly informed projections there. But going back to these domains, using those as a way to perform a quick assessment of known services and to identify gaps to be filled, it would be really helpful. Here we have some examples of risk factors for addiction across those four domains. People who have just one of these risk factors are going to need a lower dose of prevention than those who might have all six. In Pennsylvania, we measure the risk and protective factors for 6th, 8th, 10th, and 12th graders through our PAU survey, or the PAYS. I'm sure most of you are familiar with that. This is a student survey administered by schools every 2 years. For those of you who may not know much about the PAYS, you can head over to the PCCD website, and we'll be waiting for the most recent round of PAYS data to pop up there really any day now. They're expected in May. So here we have not really a comparison, but two of the data points for some of the counties that we serve. So in Lancaster and Lebanon counties, the risk factors most prevalent among our youth are the belief that drug use isn't harmful, low neighborhood attachment, and low commitment to school. A major risk factor for addiction, of course, as we've discussed, is genetics. This is really an important conversation to have in families. We have a lot of conversations in our families about our health risk factors for heart disease and diabetes. Increasing the normalcy of that conversation in our communities and modeling that for families can really help us destigmatize the disease of addiction and better prepare our youth for choices ahead of them that they'll have to make. All right, here we have our examples of protective factors. Protective factors can be as simple as feeling connected to those around you, or as complex as believing in a higher power. Research supports the value of a positive, meaningful relationship in a person's life, being highly protective, and that research is growing all the time. It's important, it's helpful and important to think of protective factors as really like a building block. No one factor alone can prevent substance use disorder. It's really the combination and the defense to our overall health that we build with those blocks. So in both Lancaster and Lebanon counties, the protective factors that are highest are family attachments, opportunities for social involvement, and belief in the moral order. Our school-based and community-based programs are focused on building these protective factors, teaching skills to exhibit leadership, building strong social and community supports, and resourcing parents so they can create a strong family bond and a helpful, positive home environment. When skills are practiced regularly, individuals can actually grow or regrow the pathways in the brain that are needed to actually use the skills when they're called on in the future. Equally important to understanding prevention as an activity and a field is this understanding that we're just a part of the overall continuum. This is really the full display of our team effort across the areas of addiction. Compass Mark's work falls into the categories of health promotion and prevention primarily. However, when we're moving beyond the highest risk level indicated folks into diagnosed substance use or gambling disorder, the continuum starts shifting to treatment. Here in Lancaster County, we have a very robust network of excellent treatment programs. One of the services we provide is to connect individuals with those programs and help them navigate options, because the entire experience of getting to help sometimes is complex and difficult. They could be further complicated by insurance availability and level of care needs, but if someone really needs help, we will get them into a program. Sometimes we receive calls from loved ones looking for some support who might really be struggling to navigate the impact of addiction on their family. So once an individual successfully moves through treatment, they're entering into the recovery side. Recovery is really a state of being well and providing specific maintenance to that wellness, which people who are in recovery from many chronic illnesses can identify with. There are many opportunities for individuals to link into recovery supports and programs on local levels for individuals on that journey. We know that every area of the continuum working together to inform and support another person's efforts really strengthens us collectively, but also individually. A few years ago, they made some changes where they added the lower line of going both way. And what that means is promotion throughout. That was a newer addition to the continuum. I'd like to share this example of an effective prevention effort that really required collaborative, data-driven work across every field in that continuum of care. Before our communities really were aware that we were having an opiate problem and then later an opiate epidemic, folks in the drug and alcohol services already knew that we had a really big problem developing. We knew that opiate prescriptions were problematic, and we were seeing a lot of folks coming to us looking for help and entering into treatment due to substance use disorders or opiate use disorders that had started with a prescription and later been transferred into a different type of use because of failure to obtain that prescription. So we collaborated across the continuum, sharing data and educating one another on what we were seeing in each area of that continuum, and intentionally strengthened or promoted each other's position. These efforts provided public education, they changed whole systems, positively impacting stigma of the disease. A lot of great projects specific to the destigmatization of addiction came out of that work, and ultimately, directly and indirectly, impacted prescribers' prescription vigilance. The decline in overdose deaths happening today really is due to this going upstream to our prescribers and also pulling people out of the water along the way. Lancaster County has experienced this gradual, consistent decrease in dispensing, which is exactly what we knew at the beginning of the opiate epidemic needed to be reduced and then sustained for reduction in death over time. So here we have a little snapshot from our Lancaster County PAYS report. This highlights specifically early initiation and higher prevalence of drugs across a lifetime. So when we asked the kiddos here, this is smallish, sort of three biggies are highlighted there: alcohol, marijuana, and inhalants. Using prevalence of certain substances is key to understanding where we might need to make or advocate for system changes or increase our prevention efforts. Earlier, I mentioned the PAU survey and those results hopefully coming out still in May. We use this to track specific risk and protective factors by county. It also collects data on used substances among high school students. So there are some other reports specific to different drugs. These are just the three that I have pulled here for you today. The first chart represents alcohol, which is by far the most commonly used substance among youth in Lancaster County. The far right bar represents 2017. So you can see that reported use is declining over previous years. And it's below the PA state average, which is represented by that small dot. But still, nearly 60% of high school seniors have used alcohol. And this is a concern as it has an effect on their developing brain and increases the likelihood of abuse for that and other substances in the future. Marijuana at that time was the second most used substance. And although it historically was going down, we're eagerly awaiting the 2019 reports to see how expansion of medical marijuana may have impacted accessibility and perceptions of use. Ultimately, we're projecting increasing that, but we'll see. Tobacco use is down, but as you can imagine, vaping and e-cigarette use specifically continues to rise. Another thing that we measured in newer years of the PAYS survey is stressful events. So we know that the experience of grief and stressful events, like worrying about running out of food or skipping meals due to financial issues in the home, directly increase a kiddo's individual risk levels. The ways in which we work across our silos or along that continuum to increase supports that address those concerns, like food insecurity, have direct addiction prevention value. As we evaluate our current environments, it's safe to say that there has been an abrupt change recently, and these impacts that we're experiencing now really will have long-term impact on these areas for our kiddos and families alike. So against the backdrop of that data and what we've talked about regarding prevention science in general, I'd like to take a minute to talk a little bit about our COVID-19 situation and how that has several implications for our work. The first bullet that I've placed up there is our increased social isolation. During this time of social distancing, many of the opportunities that we previously had for social engagement, school involvement, positive neighborhood activities, really the environment where social development strategies typically take place, have been eliminated. We know for a fact that this increased isolation causes greater risk for substance use and other addiction, whether for youth or adults. We like specifically for a resource, the Search Institute's checklist for building developmental relationships during COVID-19. You can head over to their website and find that. I think it's searchinstitute.org. Another primary concern that we're having is around alcohol use. The closure of our state liquor stores created a serious issue for those with alcohol dependency, as this withdrawal really is potentially fatal. In other parts of the country, alcohol sales have increased more than 50% since COVID-19 began, which is really concerning for people who were at low risk ahead of COVID-19 quarantines, and also for folks that are experiencing chemical or alcohol dependency. As this increase occurs, we can connect it to an increase in domestic violence, which has been an ongoing, I think, focus in a lot of our professional lenses. This is altogether troubling for kiddos who are at home that are witnessing this increased consumption of substances and really living surrounded by the behaviors of that youth, created by that youth. For some people, the shelter in place has occasionally brought out the best in us. I think we're seeing a lot of really hopeful, positive things coming from our schools to celebrate their seniors who will either have a canceled or delayed graduation. And those are really wonderful protective factors. But for a lot of us, this experience has taken us to a place of heightened anxiety and stress and depression. It's important that we pause and consider how we and our families in the community are coping in this new environment. Are the things that we're doing in our work and home environments healthy or potentially less than healthy? How are we responding? And where do changes need to be made? The next three bullets that we've been talking a lot about in our organization are, we'll start with tobacco, marijuana, and vaping. So one of the early pieces of research around COVID-19 and sort of your likelihood of becoming ill correlated directly to this issue. So COVID-19 impacting the respiratory system, the link there is that the use of any substances, previous or current, could really leave you with a higher susceptibility to contract COVID-19 and have worse recovery outcomes. Quick word about trauma here in the second bullet point. Individuals are facing health threats, job loss, food insecurity, gaps in education, and again, these alarming increases in depression and domestic violence. All of these cause trauma and consequently increase our risk for addiction. We're particularly concerned at Compass Mark about the impact of COVID-19 on communities of color and the need to provide culturally appropriate prevention and treatment services. In the United States, it's estimated that more than 20 million people suffer from substance use disorder. Phones to helplines in both mental health and drug and alcohol are really not ringing right now. This tells us that folks are likely not getting the help that they might need. We need to work to prepare ourselves for the potential implications of that fact across public health. Let's see. So again, I want to thank all of you and really applaud you for the work that you're doing in your respective place across the continuum. I have been so encouraged by what I'm seeing across social media and on our networking calls by so many of the amazing organizations that we're lucky to have here in Pennsylvania. So with that, I'm going to turn it back over to Mr. Eric to pull up the tail end here of our presentation today. At least I hope I'm going to.
Yes, you are. Just 1 second here. I had it all queued up and
It's probably
on my slide here. I'll just
Yeah.
run through it here.
I'll get to do it again, guys.
There we go. So yeah, in closing, we want to highlight, we're going to have a little bit of time here for people to submit questions via chat, but wanted to really highlight a couple ways that prevention can and should be continuing to happen. I think Bevan talked really well about how this whole COVID situation is really a concern for us because many of the it's accelerating many of the risk factors that we already know are in place, and many of the basic needs that are so critical right now. We anticipate obviously those need to be addressed now, but the longer term impact of COVID in terms of mental health and substance abuse is going to be around for a while, and so we need to start doing prevention now to effectively prepare for that. So really just want to highlight here a couple ways that prevention can happen. So at home, parents and caregivers really can and should communicate clear standards about alcohol and drug use. It's so important to have the conversation because if you don't, there are many other influences and messages that will be infiltrating a child's life. And so we often say talk early and talk often, using age-appropriate content, of course. But the important piece is that you're having that conversation about what the expectations are in the home. And we have on our website, we have some resources that we've put together to help guide those conversations. And hopefully they're helpful for those of you that are interested. Schools also obviously a place where so much social and emotional learning is taking place, as well as academic learning. And so schools are a key partner for us in these efforts. If you're an educator, look into what your prevention curriculum is in your school or your district. Make sure that whatever you're doing is evidence-based and has been tested. As Bevan talked about, we have a lot of programs that feel good and we may have done for a long time, but it's really critical that we're evaluating and making sure that we're doing programs that are evidence-based. And if you're a parent, reach out to your school district and ask what programs are being used. Encourage your school districts to be using evidence-based programs and invest the necessary time and resources. On the community side, obviously providing healthy activities for youth and adults in the community, it is so much more challenging right now with all of the isolation that's taking place. But there are still creative ways that we can build connection and establish those positive role models and mentoring programs. Many of them are transitioning to online formats. One strategy that we really have taken a liking to at Compass Mark is the social development strategy. This is a framework that was developed by Dr. Hawkins and Dr. Cayetano, and it's really the foundation of the communities that care model, which some of you are familiar with. It's a really simple process of providing young people with skills, opportunities, and recognition. Those three things are just so critical: skills, opportunities, and recognition. And combining those with opportunities for that social bonding is a really effective strategy. So if you're interested in learning more about that, You can do a search for social development strategy, and there's some great videos and concepts around that framework that you can take with you. Another place is in the workplace. So it is possible in the workplace to have fun staff events that don't need to involve alcohol or gambling. And it's really critical that employers are thinking about raffles and things like that may be fun, but can it be a triggering point for individuals that may have an addiction? And same with having alcohol served in venues. You don't know who all is involved in your workplace, and some it may not be appropriate for you to be providing that. Also, workplaces can invite people to come in and do a presentation to your staff about addiction resources. Every employer is impacted in some way, whether it's present among your employees or their family members. And really the benefits of giving them resources and supporting them and reaching out for help far outweigh the consequences of not addressing it. So one example is the employee assistance program, but of course there's many others. And finally, the faith community. So presentations at churches, doing informational sessions around social development strategy or 40 developmental assets. There are a lot of churches here in Lancaster that are starting recovery support teams, which can be a great resource. One of our partners is the Goal Project here in Lancaster, and they're especially doing work around building the capacity of local congregations to support those experiencing substance use in the congregation. So finally, in conclusion here, a tagline that we like to use at Compass Mark is that prevention works, treatment is effective, and people do recover. There is still so much stigma around addiction, and it's easy to get discouraged by the impact that opioids and substances are having on our community. As Bevan said, more than 20 million people have a substance use disorder, but the statistic that isn't often talked about is the millions of people that have recovered, and the millions more who are going down a different road because of prevention. So our message at Compass Mark is always one of hope. There's no shame in reaching out for help. We are here. We're ready to support you and to support our community in helping to guide people on a path toward healthy and fulfilling lives free from addiction. So I appreciate all of you tuning in here and participating in the presentation. I'm going to turn it back over to Katie at this time.
Thanks, Eric. I also want to thank everybody for participating today, and to let you know that, as Eric said, we are open and we are always available to answer any questions or concerns that you may have. On the screen right now, you can see Bevan's contact information, her email address there, as well as Eric's contact information and email address. Like I said before, I can't stress this enough, is that we are open. So please feel free to call into our office while our staff is working remotely. They're working very hard from home. And the phone number there for our offices is on the screen as listed. Throughout the presentation, Eric and Bevan did a great job of mentioning some of the resources that we do have available, and they are available on our website, which is listed there as well. What I'd like to do now is, throughout the presentation, many of you had sent questions along, and what I want to do is allow Bevan and Eric to answer some of those questions now. We are going to do our best to answer as many as we can as quickly as possible, but please know that after the presentation, we will be sending the list of questions that were answered and unanswered with the correct answers, as well as the recorded presentation, so that if you need to go back, if you need to review anything, that you can also do that as well. So to save some time here and get these pressing questions out the door, Eric and Bevan, what I'll do is just read them to you, and then you can decide who wants to take it, if that's all right.
Sounds good.
Great. So we got a question from Rebecca that said, and this one is for Bevan, can you repeat what you said about influence of genetics and how much that increases the chance of addiction?
Sure. So Harvard Medical School has done a lot of research. I think some of really the best research that exists around those genetic factors and that predisposition for addiction. And what their research is consistently saying, probably over the last 10 years, is that up to 50%, but some research even suggests closer to 70% of our risk are born, the day we're born risk present for addiction could be between those numbers, 50 and 70%.
Great, thank you. We had another question from Michelle from White Deer Run. She said that they had seen a real decrease in the number of people coming into inpatient treatment. Eric and Bevan, can you speak to the number of calls that we're getting in the office from people looking for inpatient care during this pandemic? Or just talk about some of the calls we have been receiving?
Yeah, I think Bevan indicated too that nationally the number of people reaching out for help has been declining during this COVID period. We're seeing that here in our office. We are still getting calls, and that's encouraging, but it is certainly been decreasing over the last couple of weeks, and that's concerning because we know that the issues have not gone away. Many times they've actually been accelerated, as we talked about. So part of our work and what we're really trying to do is to get that word out there that treatment programs, inpatient detox, all of that is still open, and we're really encouraging the community to get that word out there so that people know that that help is still available.
Great. Yeah, and I just want to quickly add to that when we've discussed this internally, and when I speak with, I know many of you are familiar with Amy Sechrist, one of our certified prevention specialists. Amy really likens that change to sort of what we see around the holidays. It's just not pressing, right? Like the first thing that we think about when something significant is happening around us in the environment isn't necessarily ourselves or checking into a residential treatment even. So typically when we hit the other side of a holiday season, we do see a small peak of folks reaching out for help. So it's safe to assume we'll see something similar based on that history we have.
Great. Thank you. I think a lot of this work that we do is really community-based. We rely on our partners, we rely on other organizations and individuals to really help us be champions for prevention. One question that we received is, what education is being given to healthcare professionals about the dangers of pushing opioids on patients?
I don't know, Eric, do you want to take that from maybe like the joining forces angle?
Yeah, as a result of being part of joining forces, which is Lancaster County's coordinating entity really around opioids, Lancaster General Health, I know, is very actively involved in that effort, and all of the local healthcare providers are also part of a South Central opioid collaborative, which is doing a lot of education and work with the provider, the healthcare providing entities in our region. So CompassMark is not actively involved in doing that. It's a little bit outside of our wheelhouse, but I can say that that is happening. There's a lot of education that's happening for prescribers, providers around all of these things. But I can't give you specifics on that, unfortunately, at this point.
Thanks, Eric. In the essence of time, I know a few folks had reached out to say, what time are we wrapping up? Because I'm imagining a lot of us are going from Zoom call to Zoom call here. But one last question that I would really like both Bevan and Eric to talk about is, it's a question that came through from Lori, and she asked, Does Compass Mark have any online lesson plans for prevention or social emotional topics that can be used through virtual classrooms? And I'm really excited about this question, but I'll let Bevan and Eric talk about our staff's hard work that they have done to provide these lessons.
Yeah, thank you. Thank you so much for asking that question, Lori. I was so grateful to see our staff really model resiliency when this all sort of went down and we knew schools were closing. Their next focus was, okay, so how do we still reach our students? And so some of the groups that existed during the school year before school closed were able to continue virtually. There were like 2-week gaps for many of them, but the first thing we launched into was pre-recorded sessions. So if you head over to the Compass Mark YouTube channel, we have playlists by grade or grade and program. So you can assign those to students and they can take them. We also are finalizing our live session schedule, and of course with student permission and the considerations around live groups happening in students' homes and limited access, all of the other things we're facing, across our organizations. It took us a little longer to pull that together, but we will have that posted on our social media and our website so that you can review the schedule and they can be pushed out through the social work and guidance departments. Because yeah, we really feel like right now is not the time for prevention to slow down. We really need to ramp up.
Great. Eric, is there anything you'd like to add before we wrap up for the day?
No, I would just, to that point, yeah, there's a lot of our training. This is, as Katie said, this is our first kind of foray into the webinar piece, but we are looking to do more of this type of training and education for the community. Also, our Student Skills for Life program that accepts referrals from the community, from district judges as well for youth that maybe are already experimenting or have highest risk. That program has transitioned entirely to a Zoom format, and so that's been exciting for us to see that happen and allow it to continue to serve youth despite the situation we're in. So yeah, it's an evolution for all of us, of course, as we navigate all these new technologies, but prevention can and will continue to happen this way too. So
great. Yeah, and if folks are seeing things that we're not seeing, right? So we're all sort of divided now logistically. If there is a need in your respective place on the continuum that you think we can support or contribute to, please feel free to reach out to myself or Eric, and we'll do our best to evaluate how we can help.
Wonderful. Well, thank you, Bevan and Eric, and we'll go ahead and wrap up now, but I just want to say thank you for all the participants that joined us today. We're incredibly grateful for your support, and we really, like many of you, we're just trying to get through this and, really be examples of one of our core values, which is resiliency. So we really thank you for your patience today. Thank you for joining us, and thank you to our staff who continues to just pivot and adapt accordingly so that we can still get this information, which is much needed right now, out. And like many nonprofit organizations, we're super thankful for our donors who allow us to be able to employ such great staff and get these programs out where they're needed. So again, thank you. Please keep your eyes and ears open. We will be having more webinars in the future around our programming and things that we're offering during this time. And if you should have any questions, please contact Bevan or Eric. Their contact information is listed there. Thank you so much. And we look forward to working with you in the future and hearing from you very soon.